afternoon to everyone, and for those of you who need a bit of extra glucose boost after lunch, please grab a Lotus Flower biscuit on our stand. Or alternatively, I'm sure you all saw the shooter glasses, so just have a shot of Sinopol. But thank you very much, and thank you again for the privilege to also present here at your beautiful conference. So just a brief introduction of myself. My name is Kristin. I'm the responsible pharmacist of GDC, or otherwise known as Golf Drug Company, and we are responsible for Sinopol in South Africa. Perfect. So in some of the preceding presentations, you might have referred to PCOS or PCOS. So polycystic ovarian syndrome, what is that? So if we break down the word, poly means multiple, cystic means abnormal, ovarian means obviously ovaries, and then syndrome means just a collection of signs and symptoms. So basically what it is multiple abnormal egg cells that causes havoc. So what PCOS does is it creates an insulin resistance, and apologies, the nerves is getting the better of me. It causes hormonal imbalances as well as metabolic disorders. So it is estimated that about 10 million women around the world actually suffers from PCOS. But only 80% of those women actually are aware that they have PCOS. So what are the signs and symptoms? And you might recognize a few of the signs and symptoms yourself. So in adolescence, it presents very differently in different stages of a woman's life. So at adolescence, you might get that little bit of weight gain, acne, insulin resistance. Then moving to adult women, you might get the insulin resistance as well, obesity, and then infertility as well. And then we move to the more mature women, we get complications like type 2 diabetes, increase in cholesterol, that leads to cardiovascular health issues, and then also endometrial. So if we look at the clinical manifestations, we've grouped them into four, just kind of for better visibility, but they all work kind of concurrently. So the first one is hormone imbalance. So 90 to 95% of women with PCOS don't ovulate. So if you don't ovulate, you can't fall pregnant. So you get PCOS-associated infertility. Then another hormonal imbalance is the insulin resistance, which leads then to hyperandrogenism. Hyperandrogenism, which means increase of male hormones in the female body, and we know that causes unwanted hair growth, causes that unwanted moustache, and even mild baldness in women. Also, we've heard about the oxidative stress and the importance of antioxidants as well. So the egg cells don't like free radicals, and that's also a big cause of infertility. Yeah, so moving on to my colleague, who will present Sinopol for us.
Thanks, Kristin. And can everyone hear me? Good. So my name is Havenga, and I'm a project manager in pharmaceuticals focusing on new product development. So just a bit in the background and knowing what I know and working on these projects. So as Kristin mentioned, it is actually a global product. So GDC, or Golf Drug Company, is actually the exclusive distributor in South Africa for Sinopol. And then previously, I know some of you mentioned you've seen the product before. Sinopol had the purple package. It went through a global rebranding. It looks gorgeous, rose gold. You just want to drink it, even if you don't have PCOS or insulin resistance. So that's just what it looks like. And for some of the questions, it is in Dis-Chem, your corporate pharmacies, independents, or otherwise, just contact Golf Drug Company, and we'll ensure you get your product. Okay, perfect. So, to be clear, Sinopol is a health supplement. So you do not need a doctor's script. You can get it yourself from the pharmacy. And the key word, and you will see it in our logo, let me just jump back, you can't see it at the bottom, but it is restoring balance. So the importance of Sinopol is assisting with restoring balance in females with PCOS and then insulin resistance. I think the words have been reiterated today about balance. There's a lot of nutrition, antioxidants that plays effect there. So we want to balance and assist that part of it through using Sinopol. And sorry for the quality of the image there. What we want to pride ourselves on as well is Sinopol has 13 clinical trials on Sinopol itself. Not literature substantiated, Sinopol. And that's the privilege of being part of a global brand. We have that opportunity in licensing it in. The work has been done, and there has been great results. So I will talk a bit more about our fast flow technology. We have a specific technology. So you will see, and you will see outside as well, there are small granules inside our solution when you make the solution up or ready to drink the sachet. So focusing on the sachet, we focus on the unique formulation with alpha-lipoic acid that is encapsulated in this fast flow technology. So alpha-lipoic acid is an antioxidant, again a word repeated today, that has a very short half-life. So you use it and its efficacy dies off very quickly. So through the technology, and you guys are welcome to have a look outside later, the capsulation ensures that we have a full 24-hour coverage of your exposure to alpha-lipoic acid. So it protects the antioxidant, and through that time period, drinking your 2 sachets per day, you will get your needed alpha-lipoic acid. It also contains myo-inositol, folic acid. Myo-inositol has got numerous studies. I'll get to the next slide now on the effect on insulin resistance and PCOS, but folic acid for your neural tube deficiencies or defects that happen. And then you will see something interesting on the side. Nobody has heard of this before. You are the first to hear this. We are launching a tablet earlier next year. Not everyone wants to drink a sachet in the morning, so make the solution. So for that hassle, there will be a tablet and then some additional ingredients, betaine added, your vitamin B6, B12 and B2, or B5, apologies. And then just the explanation there at the bottom on the alpha-lipoic acid on the fast flow technology. Just a note, alpha-lipoic acid is a very good universal antioxidant. You will hear a lot about it. It's part of the group of the mothers of antioxidants, if we can call it that way. So as I said, Sinopol is substantiated by a lot of clinical studies. So the results, it speaks for themselves. I can't really see there, but I just want to highlight some of it to you. So alpha-lipoic acid and myo-inositol, the combination, irrespective of Sinopol, there is numerous literature studies about it. However, in Sinopol, we found a 44% increase in pregnancy success with patients undergoing IV. Then significant improvement in menstrual cycles from 2 to 5 cycles in 6 months. 40% volume reduction of ovarian volume reduction. Then PCOS patients with familial diabetes had a 43.8% insulin resistance reduction. Adolescent girls with PCOS, 35% reduction in insulin resistance. So, I mean, it's incredible in what this product has done with the research that they've done. The hyperandrogenism, for those, just to group it again, that's your sex hormones, and when that's out of balance, you get more male hormones, your testosterone, so your erotism, the mustache Kristin referred to earlier, all of that plays a role there. 40% reduction, 26.4% reduction in androgenism, 16% in the erotism. And then oxidative stress, and I've repeated that, antioxidants. That means you have healthy cells in your body, your general health, in general, irrespective of if wanting to conceive, needs antioxidants. So these results are on Sinopol, and we are very proud to represent this in South Africa because results speak for themselves in different scenarios. The product originates from Spain, so it is at that point when the research was done, the most studied product on the market. Just showing the work that has been put into it. So remember, I have spoken about the fast flow technology. When you refer to the bottom graph specifically, you will see an extension. Time is your lower bar. Obviously a longer time that you see there and a high concentration. That is what we refer to as the fast flow technology. So a high absorption of the alpha-lipoic acid over a long time. That is what we want to achieve with the antioxidant. When you refer to the top graph, that's alpha-lipoic acid in a normal instance. You immediately lose that effect. So you do not want to lose that effect, and that's why our product is formulated with the small granules. You are welcome to have a look at them later. Just for those, you'll see in your bags that each received on the tables, there is a pamphlet on how to drink this. Do not worry if it doesn't dissolve. It is not supposed to dissolve. So the product will have granules at the bottom. That is what we refer to all the time as the fast flow technology. It will slightly gel as well. That is absolutely normal. So pour your sachet into water, stir it, drink it. Try to get every bit of your granules. Do not leave them behind. That's where the magic lies. And then just from a social media perspective, you guys can have a look at, this is the South African social media, what the brand looked like before. As I mentioned, we are doing a revamp, and soon you will see the new package featuring there, and soon the tablets launch as well. So please follow us as well and keep in touch with others' journeys or what we achieve for the brand as well. And that is all from my side.